This is chapter 43, alterations in digestive functions of children. Thanks to Elsevier, the publisher, and McCann's Pathophysiology for a lot of the content in this presentation. The chronic bowel symptoms frequently associated with celiac disease or gluten disease, but they may simply be another form of adult abdominal colonic disease. So it's 1% world, involves cellular and human immunity, causes T-cell mediated autoimmune injury. So there's a result in mucosal cell destruction and inflammation. So this is really quite remarkable. Gluten is a protein component of grains, natural wheat, rye, barley. Person loses villus epithelium in the intestinal tract. Gluten protein acts as a toxin. It appears to be caused by environmental and genetic factors and immunological factors. So it's relatively rare. So you have gluten intolerance, you have the T-cell overreaction, villus injury, decreased carbohydrate absorption, mucosal bowel, malnutrition. Clinical manifestation of an infant is diarrhea, meconium, illness, early signs, stool, pale, bulky, greasy, foul-smelling, fail of the child to grow, malabsorption syndrome, rickets, bleeding, anemia, fat-soluble vitamin deficiency, dehydration, malabsorption, protein loss, magnesium, calcium, malabsorption, irritability, tremors, convulsions, tetany, bone pain, dental and osteomalacia. So this is what would happen in a society where a child's born and they really can't do anything about that. These would be the kind of the late stages of disease. Okay, you get dermatitis herpetiformis, which is an itchy blister formation on the elbows, knees, and shoulders, midlines of the back and buttock. An evaluation of this disease is really a rather significant immune disease and requires the help of rheumatologists and pediatric immunology docs. Treatment: immediate and permanent institute a gluten-free diet. This would be a complete, immediate gluten-free diet. Lactose, milk, sugars tolerance is presumed because damage to the village, lactose excluded from diet may be reintroduced after healing. So fat-soluble vitamins, iron, and folic acid supplement. What is the pathophysiological process that occurs in a person with gluten sensitivity? Is a T-cell mediated autoimmune injury to intestinal epithelial cells, the deficiency of pancreatic enzyme, atropic disease involving immediate delays, and a return of the stomach contents because of incontinence. So it's a T-cell mediated autoimmune injury to intestinal epithelial cells. Malnutrition. First corpse is severe protein deficiency, occurs in infants and children from 1 to 4 years of age, have been weaned from breast milk and a high starch diet, protein deficient. Marasmus is a deficiency of all nutrients in children younger than 1 year old, attributed to lack of protein and carbohydrates. Obviously, all one has to do is turn on PBS or the national news at night and see a constant example of starving children in Africa, particularly in Africa, where in Syria also, and in Yemen, where the horrendous effects of war cause people to starve, and children are remarkably sensitive to starvation. Major risk factors: chronic disease, pathophysiology, cough, malnutrition, inadequate dietary protein, leaky gut syndrome, intestinal inflammation, stored fat in the liver, pancreatic atrophy, and fibrosis. But the most common one would be dietary lack of protein. And marasmus is a metabolic process of preserved but growth is severely retarded, muscle and fat wasting. So that's if you continue to starve. Clinical manifestations of marasmus, fatty liver, hepatomegaly, wasting, diarrhea, infection, low hemoglobin, Korsakoff, generalized edema, dermatosis, hypopigmented hair. This is what you notice many times when you see pictures of children, for instance, in the Middle East who are starving, like in Syria during the war. They appear to have blonde hair. Yet their parents are Middle Eastern and have very dark hair. So the hair is hypopigmented, their abdomens are distended, they have hepatomegaly, and normal weight for age due to edema. Treatment provides deficient nutrition, ready-to-use therapeutics, breastfeeding is an antibiotic. The UN has a new substance for children. It looks like paste. It comes in a little plastic sack. Squeeze it out, and the children can eat it with their hands. And it has the consistency of peanut butter, but children like it, and it can reverse all these forms of malnutrition if they can get it to them, and usually children eat it. Failure to thrive is inadequate nutrition to optimal growth and development, deacceleration of weight gain or loss, weight to height ratio, low weight to height, circumference ratio, biological, psychosocial, environmental. Clinical manifestations of delayed growth accompanied by manifestation of underlying disease, pallid, dry, cracked skin, sparse hair, poorly developed musculature, decreased sebaceous fat, subcutaneous fat, swollen abdomen with malabsorption, diarrhea, anorexia. Social and emotional manifestation, reduced energy level, reduced responsiveness, interaction with social environment, social isolation, spasticity, rigidity and spasticity when held to touch, inability to make eye contact, refusal. Evaluation fall below third percentile in growth curve. Treatment most successfully was not only treated the growth curves, but is assisted parents with feeding practices, manage psychosocial. Necrotizing enterocolitis is a ischemic or inflammatory condition that causes bowel necrosis and perforation, causes infant death if untreated. The most common gastrointestinal emergency in newborn children is thought to be formed from reduced mucosal blood flow and immature mucosal barrier. Ischemia leads to inflammation, necrosis, and intestinal segment perforation. Bacteria invade the mucosa. Triggering factors of infection, abnormal bacterial colonization, exaggerated immune responses, immature immune responses, exaggerated inflammatory responses, clinical manifestations, feeding intolerance, abdominal distension, bloody stools after 8 to 10 days of age, septicemia. If you miss this diagnosis, the child will die. And if they don't die, they'll lose major portions of their gut and intravenous feeding. Treatment cessation of feeding, milk, gastric suction, decompress, maintain fluids, electrolyte, administer antibiotics, control septic, and surgical resection. This necrotizing enterocolitis is the same thing that occurs in fascia, necrotizing fasciitis, which can occur in injury. We talked about that early on in the semester. Necrotizing fasciitis it can lead to a substantial loss of tissue and require major skin grafts and death and amputation. Diarrhea is the increased water content and volume in stools, acute versus chronic. Prolonged diarrhea is very dangerous. Children have lower fluid reserves than adults. Causes osmotic secretory intestinal. Of course, cholera is a major cause in the third world of diarrhea. And we talked about how to make saline fluid that the children can drink and adults can drink if they have cholera, adding 1 tablespoon of salt to a liter of clean water. Infant diarrhea dangerous. Dehydration is great. or infant infectious diarrhea associated with acute viral, bacterial, and contaminated food and water. Retrovirus, the leading cause of severe diarrhea in infants and young children worldwide, and chronic diarrhea lasts longer than 2 weeks. Treatment, rehydration with fluids and electrolytes, maintenance of nutrition, treatment of associated conditions, antibiotics, prevention, clean water, good hygiene, environmental sanitation. Serum bilirubin values increase greater than 5 milligrams per day. Persistent jaundice more than 7 to 10 days after other causes of jaundice. Treatment, physiological jaundice, phototherapy, ultraviolet light to eye protection, and pathological jaundice, high intensity phototherapy, exchange transfusion, and underlying cause. Biliary atresia is a rare congenital malformation characterized by the absence of obstruction of extrahepatic bile ducts. The inflammation, fibrosis, and loss of epithelial cells, obstruction of biliary cannulae. Primary clinical manifestation is jaundice, so the biliary tract is atresed, not open, there is no tract, it's missing a piece. Surgical drainage and correction, certain portoenterosunts, and liver transplant. This is one of the operations they do on these children, where they do swing a piece of small intestine into the liver. Hepatitis A, HAV, is 1/3 of the half of all causes in children. HAV replicates in the liver and excreted through the biliary system in the stool. Vaccine should begin at 1 year. Hepatitis B, newborn affected hepatitis B from their mothers and chronic hepatitis B carriers. An aggressive vaccine program, maternal antiviral therapy during pregnancy. And Hep C is primarily associated with blood transfusion and maternal HIV. Antivirals are effective in treatment of Hep C. Liver transplantation required for liver failure. Chronic hepatitis, many causes, Hep B or C, manifestation malaise, anorexia, fever, gastrointestinal bleeding, hepatomegaly. No cure therapy. Liver transplantation may be needed. Don't think about cirrhosis occurring in children, but it does. Fibrotic scarring in the liver occurs in response to inflammation of damaged tissue. Chronic liver disease in children can be aggressive. Cirrhosis, although infrequently. Complications of cirrhosis in children are the same as their adult, and children may experience growth failure, nutritional deficiency, and developmental delay. Portal hypertension causes increased resistance of blood flow within the portal system, increased volume of portal blood flow. So you have extrahepatic portal hypertension, the main cause of obstruction of the portal vein, and you can do a mesoportal bypass. Intrahepatic portal hypertension, the most common cause, cirrhosis, congenital hepatic fibrosis, and so you have splenomegaly, gastrointestinal bleeding, ascites, hepatopulmonary syndrome, hepatorenal syndrome, and hepatic encephalopathy. Treatment is the same as adults. Question 5, intrahepatic portal hypertension is associated. Intrahepatic portal hypertension is associated with umbilical vein catheterization? No. Obstruction of the portal vein? No. Cirrhosis, right? Intrahepatic, right? Cirrhosis. Intrahepatic. Pancreatitis is the pancreas. Wilson's disease is an autosomal recessive defect of copper metabolism, causes toxic levels of copper accumulating in the liver, brain, and kidneys. It's related to a gene. Anomalous diminished biliary excretion of copper, failure to insert copper into certain necessary metabolic occurrences. Clinical manifestation, neuromuscular abnormalities, intention tremors, dysarthria, indistinct speech, dystonia, disorders of muscle tonicity. They can get cirrhosis associated with elevated copper levels. Treatment, decreased dietary copper intake, intestinal copper absorption, increased renal excretion of copper, chylation therapy, and liver transplant. Case study, a couple travels to the developing country to meet a young child who is available for adoption. They're seeing pictures and are anxious to finally meet the child and may be able to be their own. When they arrive at the adoption, they are shocked to see the level of apparent malnutrition for many children. The staff explained that many children are brought to the office because their families are economically destitute. Infants are weaned early from breastfeeding and often fed over-diluted commercial formulas. Concerned about the welfare of the child, they're about to see the parents decide that they will adopt a child and make sure he has at least a better life. So severe malnutrition and states of starvation associated with food shortage, severe deficiency, known as severe malnutrition of all associated with food shortage, severe deficiency is called marasmus, right? First is protein. Months later, the child arrives in the United States. Parents take him to full physical exam, provide pediatrician and copious medical records. Pediatricians address their concerns and institute a plan to follow the child's growth and development. The child is seen multiple times for diarrhea and anemia. Their stools are pale, greasy, and foul-smelling. Further serological intestinal testing reveals the child may suffer from gluten insensitivity and lactose intolerance. The major pathophysiological character of gluten insensitivity is lymphatic capillaries, no. Intestinal epithelial cells, A2 receptors, cryptoglycan. It is actually the intestinal epithelial cells. That's the method, the way the disease occurs.